From Kyiv is Dr. Hans Kluge. He is the WHO Regional Director for Europe. Thank you very much for your time. Just start by telling us, what are the greatest health needs right now in Ukraine and in what parts of Ukraine? Hans, just checking you can hear me. It appears we may have lost comms with Hans. Hans, if you can hear me. Nope, my apologies. We seem to have...
I can hear you.
You can hear me? Okay, very good. Fantastic. So just start by telling us, what are the greatest health needs in Ukraine, in which parts of Ukraine?
Well, right here, I'm in Kiev, and I discussed with the Prime Minister, Minister of Health, the civil society, the situation yesterday. I was in a field visit in Chernihiv, close to the border of Belarus and the Russian Federation. And there is a huge agenda of still acute injuries, of mental health, but also the longer-term health needs of chronic diseases like diabetes, cancer. In fact, 1 out of 3 people with chronic conditions do not have access to medicines needed to treat their diseases.
And those can be life-threatening, of course. You touched on something I want to talk about there, psychological support, because obviously there are many, many people who've been forced to, either directly impacted by the shelling or by the violence, or forced to leave their homes, forced to leave everything they've known, lived under shelling, the threat of death daily. So how big is the psychological need right now, and what efforts are there to meet those needs?
It's a tremendous challenge and tremendous need. Even before the COVID-19 pandemic and the war, Ukraine had quite some challenge with mental health. Now, as you rightly say, there's a lot of consequences. To give one story, which I heard, is that in a particular city, people were forced, hundreds, to live in the subway. And when the liberty, the freedom was again there, people were hesitant and anxious to go outside to the open air. So this is really a totally new, complex challenge where we need to have very targeted support. But I'm very, very relieved that the government support of the First Lady to the mental health agenda is tremendous.
How are healthcare workers managing? Because healthcare facilities have come under attack.
Absolutely. Actually, this year alone, 2 out of 3 healthcare facilities being attacked globally are from Ukraine. And this is a very, very serious breach of international humanitarian law. Yesterday, I was in Chernihiv. The mental health hospital, the cardiological center, the primary healthcare center, the tuberculosis clinic, name it, were all destroyed. So I was very disheartened, at the same time, very inspired by the heroism of the nurses, the doctors. No one left, and they were saving lives while the shelling continued.
You talked about chronic conditions. I'm wondering, with COVID, is COVID even being addressed anymore, or is it a matter of just having much bigger issues to deal with now?
Well, a little bit of both. The COVID-19 has not gone away. About 40% of the population is fully vaccinated, and remember the target of 70%. But most likely, due to the Omicron and the fast transmissibility, several people have natural immunity. The key issue, and we discussed with the Minister of Health, Victor Lashko, will be in the fall to protect and shield the vulnerable, at the same time strengthen the laboratory system for a better surveillance. And that was the second aim of my visit here, to discuss with the government how are we going to work to build back forward a more smart, digital, greener health system.
Just finally, I want to ask you about supply lines and actually the logistics of getting medicines to places that need it, particularly those places dealing with acute injuries caused by shelling or caused by gunfire, wounds of that nature. How are you managing to get, or how are the authorities managing to get, needed supplies to where they need to go?
The innovation and the resilience of the Ukraine health authorities, in partnership with the United Nations, WHO, UNICEF, civil society, is amazing. But there is a point there that in the occupied territories, this is still a concern. And that's why exactly I convened a meeting with the civil society, non-governmental organizations afternoon. And it's amazing. People, spouses driving their cars by hook and by crook, delivering methadone, tuberculosis drugs beyond the enemy lines to the people in need. But we're not fully there yet. And that's why I would like to repeat the call of the United Nations Secretary General that we urgently need a ceasefire and humanitarian access to the occupied territories.
That's hugely admirable work. Hey, thank you very much for your time, Hans Kluge there
My
from
pleasure.
the World Health Organization.